there are many medical emergencies, but one important emergency that we're going to talk about today is a condition called shock. So shock is when there is a state of collapse or reduction in the blood flow. So it means that the blood pressure goes down. It means that there's less blood going to the brain and to the tissues, to the heart, and there's less blood in circulation in one way or another. So there are many things that will actually cause shock. Sometimes you've been vomiting and having diarrhea for a long time, such that a lot of fluid has been lost from the body. That can cause shock. Or somebody has infection, in the body in one way or another. That will cause what we call septic shock. Or somebody has had a heart attack, okay? That is what is called cardiogenic shock. Shock because the heart is not pumping. If the heart is not pumping, then the blood will not flow. So that will cause some sort of shock. Or sometimes you have a nervous reaction. The shock comes from the central nervous system, from the brain. That can also cause shock. Sometimes you find that shock is also caused from somebody who has been maybe bitten by bees, okay? We call that anaphylactic shock. So there are very many things that will actually cause shock. But it is important for you to know what is the first aid treatment that I can administer onto a person who actually has shock. So now, before you are able to ascertain this person is in shock, what are the signs and symptoms that you will see in the person? Generally, a person who has shock will not be walking around smiling. They'll be lying, motionless, very ill. And they may actually have very cold, we call it cool and clammy. The skin, if you touch the skin, you find that it's very cold. And they have a feeble pulse. You know how to take care of the pulse. We've talked about that. You find that the pulse is barely perceptible and that they have rapid and shallow breathing. Sometimes you call them and they are not even conscious. They will not answer you. So then you'll be able to say this person actually is in shock. So it is best handled by treating the cause. So usually it is best handled in a center like a hospital because it's a serious emergency. But before they reach the hospital, there are 3 things that you can do as a first aider. And I'll use the acronym RAW, R-A-W, to ensure that the person with shock feels better. Number 1, lay the patient down. Let them lie down, and the legs should be elevated. Remember, we said that the blood pressure is reduced. The blood is not going back to the heart. So if you elevate the legs, it means that you are helping the blood come back to the heart to help the heart pump the blood to the rest of the body. So ensure that the person is lying down and the legs are elevated. Rest that patient in that position. The second letter is A. A stands for air. Ensure that there is adequate airflow through the airways. The airways is the mouth, the nose going down like that. If they are wearing tight clothing, if they're in a funny position, make sure that you loosen their clothes and you put them in a position where the air will be able to flow normally. The third thing is warmth. W stands for warmth. So ensure that you cover them maybe with a blanket, or if there's a heating supply nearby, you ensure that that is switched on. Make sure that it doesn't become too hot, or else they'll end up maybe overheating the body. Otherwise, it's raw, rest, air, and warmth. Wounds and bruises. How do you take care of a wound? A wound is a break in the skin. A bruise, you find that the skin actually becomes discolored because the vessels underneath are bleeding. So how do you take care of the wound? Number 1, clean the surrounding area around the wound, okay? And apply a mild antiseptic. These are the antiseptics I was talking about. Cover the wound with a suitable sterile dressing. Okay, you get this, it's sterile the way it is. You use some tweezers to pick it up and you cover the wound. If there is a bandage on top of the dressing, you use the bandage to secure that dressing in place. And then number 3, if there are embedded objects, do not remove. Apply a ring or pad or build up dressing to the area. Sometimes it's difficult to remove something that is very deeply seated, unless it's on the surface, then you can easily just take it out like that with a tweezer. But if it is embedded inside, don't try to attempt to remove. You will cause more injury. Just try and apply a pad and dressing to that area. And then use gauze dressing directly onto the wound and not cotton wool. Cotton wool, have you seen how it has all these friable parts? If you put it directly on the dressing of a wound that is open, it's very difficult to take it out once the time comes for you to take it out. So it's better use this kind of dressing. And then if there are stitches that will be needed, okay, if the sutures will be needed, usually in first aid we're not able to do this. So it means that we must ensure that this person gets the medical help that they need as soon as possible. For instance, if it's a big wound and they are bleeding, you need stitches. Ensure that that is done as soon as possible. And then also, we usually give tetanus injection, and that also cannot be done with the first aid. It may need some medical treatment to be instituted on that person. Now, bleeding can either happen externally, meaning you will be able to see it, or internally. So depending on what part of the body is bleeding, sometimes just by applying direct pressure, you are able to stop that bleeding. Okay. In other places where usually it's easier, when the application of direct pressure is easier where there is a bony surface underneath, and then you are applying pressure in that manner. But if that is not possible, you use again the dressing to help. Okay, if you put dressing there and then you tie with a bandage, that bandage will also apply pressure in itself and the bleeding will stop. You want to elevate that limb if it's a limb that is hurt, okay, and you want to immobilize it, because if it keeps on moving, it means that it will be painful and it will be difficult for the bleeding to stop. So you want to immobilize and elevate that place so that healing is not disturbed. For internal bleeding, it is difficult to ascertain exactly what is going on until sometimes probably the patient presents in shock, meaning their pulse is low and they are pale, and you don't know where they are bleeding from, but you know that they are bleeding from somewhere inside. Sometimes they'll start coughing up blood, and you will know that probably it is the lungs that are bleeding. Or they will start vomiting blood that is altered, it is brownish like coffee grounds, and you know that probably the bleeding is coming from the stomach and below. And so that is important for you to ensure that you secure medical help speedily. You don't want to delay when somebody presents with that kind of bleeding, because it's a serious condition. So if somebody is bleeding from special areas like the nose, you want them to sit the way I'm seated like this, and let them bend over, okay? The head should lean forward slightly, and then you ensure that you apply pressure to the flap of the nose like that for at least 10 minutes. Make sure that the person is not, you instruct them, don't blow your nose, okay? Stay still, and you apply that pressure until the bleeding stops. Sometimes the application of cold packs can help as well. If they are bleeding from the tooth socket, you just want to put a piece of dressing and ask them to bite. They should bite that pad or piece of gauze until the bleeding stops. If they are bleeding from the palm of the hand, inside here, you put again some gauze or dressing, and then you ask them to make a tight fist. Then you can actually apply bandage around that arm, and also put a a little sling so that that arm is put, it's secured in place. It doesn't move up and down, because that will encourage healing. So we have come to the end of our presentation. I hope that you will be able to get one or two things and ensure that you become good first aiders. Good day.